Okay, and my second question is just if I don't know if this is hard to answer, but is there any sort of guideline that you have that will indicate when you would bring back public health measures? And the reason that I'm asking is because there are a lot of vulnerable people who still feel abandoned. I saw a tweet the other day of someone who said that this has been like the loneliest time of the pandemic for them because they feel like they can't go anywhere and they can't do anything, and there's no way for them to actually protect themselves if nobody else is wearing masks and such. So,
Yeah.
do you have a sort of a measure where you're like,
Yeah.
if it gets this bad, this is when we act?
If I may, yes, we do. First of all, we analyze the virus in itself, and we do understand right now that the B4, the BA4 and BA5 are not more virulent or they do not induce a level of dramatic situation higher than the others that were before since Omicron. So the first thing is that to really understand with what are we dealing with, and with that in mind, considering that it's very contagious, the the best thing to do is not to shut down the organization of the society, but to allow it to continue with the measures that are recommended for individual contribution for each of us so we can manage our risk with that or the type of isolation that we continue to go with. Will it be to be in a restaurant? Will it be to be outside with colleagues? To be with family? You have to manage it yourself, considering your own risk. But globally, with the measures that are suggested right now, to wear the mask for the people that are at risk, or to be really careful with the infection that they are experiencing, and to get the vaccine, I think, and we all think that those measures should be strong enough to allow the society to continue without reducing the activities of any, but allowing everyone to make their choice considering their own risk and their ability to cope with it.
So, would it
Thank you.
take a more
We're
deadly
going to take.
variant to bring back public health measures?
I mean, if there's another variant that shows that it's a deadly one, that we calculate that there's a risk of increasing the risk for the system and the people, their mortality, morbidity, then it will certainly bring back some very new consideration. But this is not what we are facing right now.
Thank you.
Thank you.